The situation in Mexico obviously remains difficult. Until October the 10th, there were over 814,000 cases and over 83,600 deaths from COVID. Again, I think putting it in context, I think nearly half of all the confirmed cases have come from Mexico City. And the state of Mexico, Nuevo León, Guanajuato, and Sonora. So, in that sense, there's been a big impact in certain areas. About a quarter of the patients reported to us have required hospitalizations. Again, many people, like we've seen all over the world, have had underlying conditions, including hypertension, diabetes, obesity, were the main associated conditions there. And Mexico has been running this traffic light system, three-level traffic light system, and interestingly, many other countries have adopted similar traffic light systems in the last number of months. Mexico was one of the first countries in the Americas to introduce that traffic light system, and we would support Mexico in continuing to do that. Health personnel have been very much affected in Mexico. Clearly, protecting those health workers is very important, and we have, our PAHO office have obviously continued to recommend to Mexico to continue the training, protection and provision of equipment to frontline health workers in Mexico. There have been issues in the past on the testing strategy and the amount of testing done. I'd also like to commend Mexico. It's been very careful to try. It's had a large bump in cases over the weekend, just before the weekend, because it's actually changed a lot of its definition of cases, not to reduce the number of cases, but to actually capture more cases, particularly those who weren't tested. So Mexico now considers cases who are epidemiologically associated with a confirmed case to be cases, and the same with deaths, which actually puts Mexico in a situation where it will tend to report more cases than elsewhere, and it is to be commended for its transparency on that. So I would say yes, no more than many other countries in North, Central and South America. No country is out of the woods. Mexico continues to be in difficulty, and it is very tragic to hear your reporting on cancer patients, and we've seen this impact around the world on oncology services around the world, outpatient services and others for essential care. In many ways, and I think the DG has said this many times before, COVID to an extent has caused some of these problems, but it's also revealed huge inequities in the system. As you said, many of these issues may have been present before. So Mexico, no more than every country in the world, has serious inequities in the way healthcare is delivered and the way healthcare is paid for. And it is tragic to hear in any country that children would die unnecessarily from treatable cancers.